After the age of 50, the mouth begins to undergo slow but very real biological changes that most people don't notice until the damage has already begun, and this is exactly why dentists all over the world warn adults in their 50s and beyond to pay close attention to daily oral habits before seemingly small issues turn into painful, costly, or even dangerous dental diseases. As the body ages, saliva production decreases, gums naturally begin to recede, enamel becomes thinner, and the immune system's response in the mouth becomes weaker, allowing bacteria to thrive in places that were once well protected. The surprising reality is that many adults over 50 believe brushing alone is enough, but dentists repeatedly explain that brushing without proper technique, timing, and support habits often leads to silent but progressive damage that shows up suddenly as gum disease, tooth decay, sensitivity, bone loss, bad breath, and even systemic health complications like heart disease and diabetes. This is because oral health and overall health are deeply connected. The mouth is the gateway for bacteria to enter the bloodstream, and even a small untreated gum infection can quietly trigger inflammation throughout the body. For this reason, experts emphasize the importance of strengthening the mouth's natural defenses by adopting habits that protect enamel, promote saliva flow, soothe the gums, balance the oral microbiome, and prevent harmful bacteria from colonizing the spaces between teeth and beneath the gum line, areas that become more vulnerable as we age. When these habits are ignored, tiny pockets form around the gums, plaque hardens into tartar more quickly, and teeth become loose or infected, which is why dentists insist that the oral habits used in youth are simply not strong enough to protect adults over 50 from disease anymore. The goal is not just to clean the teeth. The goal is to maintain the mouth as a stable, hydrated, bacteria-balanced environment where disease cannot easily grow, and that requires daily habits more precise and more intentional than ever before. Another major challenge adults over 50 face is the silent buildup of plaque in areas that toothbrushes cannot reach, especially deep between the teeth and at the base of the gums where aging tissue becomes softer and more sensitive. Many people underestimate how dramatically gum health affects the stability of the teeth, yet dentists say that gum disease, not cavities, is the #1 cause of tooth loss after 50. When harmful bacteria settle below the gum line, they begin releasing toxins that irritate the tissue, causing inflammation, bleeding, and slow destruction of the bone that holds the teeth in place. What makes this especially dangerous is that most of this damage is painless at first, so people assume their teeth are fine until they suddenly notice loose teeth, swollen gums, or chronic bad breath. Dentists warn that this progression is preventable with consistent daily habits that keep bacterial colonies from hardening into tartar, because once tartar forms, no amount of brushing can remove it, only a professional dental cleaning can. This is why oral habits after 50 must focus on disrupting bacterial growth not only on the surface but in deeper, hidden areas where serious disease begins. Simple actions like cleaning the tongue thoroughly, stimulating blood flow in the gums, balancing oral pH through nutrition, and reducing dry mouth episodes make a massive difference. Even the way adults drink water, the timing of nighttime oral care, and the choice of toothpaste all become more important after 50 because the mouth is less forgiving than it was at 20 or 30. When the mouth is kept moist, oxygenated, and free of bacterial buildup, the gums remain firmer, teeth stay anchored, and the risk of gum disease drops dramatically. This level of care becomes essential because the oral environment now requires daily maintenance to remain stable. Dentists also emphasize the role of saliva as one of the mouth's most powerful natural protectors, something many adults over 50 don't pay attention to until dryness becomes uncomfortable. Saliva is not just moisture. It contains minerals that rebuild enamel, enzymes that control bacteria, and proteins that protect the soft tissues. But as we age, saliva production decreases due to hormonal changes, medications, dehydration, and stress, leaving the mouth vulnerable to bacteria that thrive in dry environments. A dry mouth accelerates decay at a shocking rate because, without saliva, acids stay longer on the teeth, enamel erodes faster, and gums become irritated easily. This is why dentists recommend habits that boost saliva flow, such as staying hydrated throughout the day, chewing sugar-free xylitol gum, eating crunchy high-fiber vegetables, and avoiding constant snacking that keeps the mouth acidic. Even breathing through the nose instead of the mouth makes an enormous difference because mouth breathing dries the tissues and reduces bacterial resistance. The connection between digestion, nighttime sleep patterns, snoring, and dry mouth also becomes more significant as the muscles around the airway weaken with age. Adults over 50 who often wake up with dry mouth, throat irritation, or bad breath are usually experiencing nighttime oral dehydration, which accelerates disease while they sleep. This is why dentists repeatedly highlight the importance of a complete nighttime oral care routine that reduces bacteria before sleeping, keeps the mouth hydrated, and prevents acids from weakening the teeth overnight. When saliva is supported through daily habits, the mouth maintains its natural healing ability and becomes far more resistant to disease. Nutrition also becomes a powerful part of oral health after 50 because the body now needs more nutrients to repair the gums, strengthen enamel, and maintain bone density around the teeth. Dentists often point out that many adults unknowingly weaken their teeth through dietary patterns that increase inflammation, reduce mineral absorption, and feed harmful bacteria. Highly processed foods, sugary snacks, acidic drinks like sodas and energy drinks, and constant grazing throughout the day create the perfect environment for decay and gum infections. On the other hand, foods rich in calcium, vitamin D, vitamin K2, magnesium, antioxidants, omega-3 fatty acids, and collagen-supporting nutrients dramatically improve oral resilience by strengthening the jawbone, firming the gums, and supporting enamel remineralization. Hydrating foods such as cucumbers, watermelon, oranges, leafy greens, and yogurt help maintain moisture, while fibrous foods like apples, carrots, and celery naturally clean the teeth and stimulate gums. Dentists also warn that coffee, tea, and acidic fruits should be consumed with awareness because acidic exposure softens enamel for nearly 30 minutes after consumption, meaning brushing immediately afterward can cause more harm than good. Instead, rinsing with water and waiting before brushing allows enamel to reharden. The goal after 50 is to eat in a way that supports the body's diminishing repair processes while reducing substances that erode enamel or inflame the gums. When the diet shifts to support oral health, teeth retain their strength, gums heal faster, and the mouth becomes far more resistant to disease. Finally, dentists stress that daily habits must be paired with regular dental checkups because early detection becomes the most powerful tool for preventing major dental diseases after 50. Many adults believe that if nothing hurts, everything is fine, but dental issues in older adults rarely begin with pain. They begin with microscopic changes in bone, enamel, and gum tissue that can only be seen by a dentist through routine exams and cleanings. Professional cleanings remove tartar that brushing and flossing cannot reach, preventing gum pockets from deepening and stopping bone loss before it becomes irreversible. Regular checkups also help identify dry mouth causes, detect oral cancer early, adjust dental appliances, and identify improper bite patterns that put pressure on aging teeth. Dentists consistently explain that adults over 50 who combine strong daily habits with routine professional care maintain their natural teeth decades longer, experience fewer infections, avoid emergency dental procedures, and improve their overall health because a disease-free mouth lowers inflammation throughout the body. The message is simple but powerful. The habits adults form now determine whether their teeth will remain strong and functional for the rest of their lives. When these protective habits become part of daily life, the mouth becomes stable, the gums remain healthy, and the risk of dental disease drops dramatically, allowing adults over 50 to enjoy confidence, comfort, and long-term oral strength.